Hello again, my name is Lily, and I have a script off to the side that I'm going to be reading off of. So today I will be talking about personality disorders. But before we get into personality disorders, I want to talk about the big 5 personality factors that people like to describe as OCEAN. And this is an abbreviation or an acronym for personalities, like how you can determine someone's personality. O stands for openness versus closeness to experience. C for conscientiousness versus undependability. E for extroversion versus antagonism. N for negative emotionality versus emotional stability. All of these, like I said before, they can help to categorize someone's personality. But with the personality disorder, patterns of thinking, feeling, and behaving markedly interfere with an individual's ability to function adaptively in the world and relate to others. As said in Chapter 9, all of this is about Chapter 9. This means that This means that personality disorders have to interfere with the basic function of an individual's day-to-day living. This typically has to be evident by early childhood. Patterns must be evident across multiple settings and environment, and patterns must be chronic, not during any other mental health crisis like depressive episode, maniac episode, any other type of mental distress. There are 3 types of categories for personality disorders. And to begin with, cluster A is when an individual has eccentric or odd personality disorder, typically having similarities to people with schizophrenia, yet they maintain their grasp on reality. And then for cluster B, this is when an individual has dramatic emotional personality disorder. People in this cluster tend to be manipulative, volatile, and uncaring in social relationships. And they're usually prone to impulsivity and may be violent and show little regard for their own safety and those around, like the safety for those around them. You can see that they're a little scary people and they don't really know how to control their emotions. And then lastly, for cluster C, this is when an individual has anxious or fearful personality disorder. People in this cluster are extremely concerned about being criticized or abandoned by others, thus creating dysfunctional relationships with people, like the people around them. With that being said, cluster A is a little more intricate. No, all of these are really intricate because they all have a smaller umbrella of different personalities that they can have within themselves. Like for cluster A, there are different personality disorders, and the first one is schizoid personality disorder, which is detachment from social relationships and restricted range of emotions. Another one is schizotypal personality disorder, symptoms similar to schizophrenia but in a milder form, so more manageable, more adaptable. In cluster B, this is where we have borderline personality disorder, where this is a pervasive pattern of unstable self-image, emotions, and interpersonal relationships, along with marked impulsivity. Another personality disorder is histrionic personality disorder. This is when there is a pervasive pattern of attention-seeking behavior, including inappropriate seductiveness and dramatic emotionality. And then along with these 2 personality disorders is narcissistic personality disorder. This is when there is a pattern of behavior characterized by an exaggerated sense of self-importance, lack of empathy for others, and excessive need for admiration. And then lastly, for cluster C, we have avoidant personality disorder. This is when there's a pervasive pattern of social inhibition, low self-esteem, and severe anxiety in social situations. Oh, and then there is also dependent personality disorder. This is when there is a pervasive pattern of behavior marked by deep-seated belief that one cannot care for oneself. And then lastly, we have obsessive compulsive personality disorder. This is when there is a pattern of behavior characterized by excessive concern with perfection and having things a certain way, along with rigid beliefs and control over oneself and one's environment. So, for one of these, I did talk about a theory that there is, and one theory that, and then for the theory I chose, it's for schizoid personality disorder. And one theory for schizoid personality disorder is some evidence that underlying personality traits may have genetic basis and a treatment, and that is the theory. And the treatment for this is psychological, like a treatment for many personality disorders would definitely have to be psychological therapy and dialectical behavioral therapy, and this will get more emotional regulation and more trust in other people, and exposure therapy is also really beneficial. And with all of this in mind, a way an individual with personality disorder can be challenged differently is when being placed in a setting where communicating and interacting with new people can be more difficult. Difficulty connecting and sharing interests with those around can cause a strain in human relationships along with friendships. And with all of that, that is my video. Thank you for watching. Bye, guys.